Hi everyone, welcome back to UWorld's Next Gen NCLEX Review. My name is Samantha. I am a nurse here at UWorld. Thank you so much for joining today. I know that we're on a few minutes late, so thank you for bearing with us, but we are here and we are ready to go. So today's topic is pediatrics. These specialty topics can be kind of complex and confusing, but we do get a lot of requests from our UWorld users, from our live viewers, and my name is all of our nursing students for more pediatric content. So I really hope that we're meeting that need by doing this today. Per usual, we're going to do the question drill style. So we'll put a question up, give you about 30 seconds to answer. Make sure you take advantage of our chat feature, drop your answers into the chat so we can see where everyone stands, what everyone's thinking, and then we'll go through the rationale in full. So if you haven't already, go ahead and share this session. Follow us at UWorld Nursing and check us out at uworldnursing.com for our complete schedule of times, topics, and channels that we plan to go live on. So with that being said, let's go ahead and get started. Question number 1. So here the nurse is assessing a 2-day-old client with tetralogy of Fallot. Which of the following findings would be a priority to follow up? Is it decreased O2 sats, tires easily during feedings, sleeps in 2-hour intervals, or a systolic heart murmur? I see some people said hi, Samantha. Hello. Thank you for saying hi. We're happy to have you all here. And also make sure, go ahead and share this live. We're on question 1 out of 8, so lots of questions ahead of us. Now will be a great time to share this. We want to reach as many of you as possible. Also, please let us know. On Monday, we did our 3rd NSNA virtual webinar of the year. We plan on doing 6 throughout this calendar year. So if anyone that's joining us today also joined us on Monday, please let us know. We also covered pediatrics that day, as well as some exam strategy with our bow tie questions and our alternate item types. So if anyone is joining that was also there, let us know. We are so happy to have you back. Alrighty, lots of answers coming through, and per usual, you all are doing so well. So you're spot on. Our correct option was indeed option number 1, those decreased O2 sats. So let's sum up what tetralogy of Fallot is first. It's a congenital heart defect characterized by 4 different things. So pulmonary stenosis, right ventricular hypertrophy, an overriding aorta, and a ventricular septal defect. So the nurse needs to prioritize our findings that impede our ABCs, airway, breathing, and circulation. This may indicate life-threatening complications and the need for immediate intervention, which is why this would be our priority. So option number 1 is a sign of potential decompensation. That's why it's our priority. So we have to make sure that we are following up on this. These infants can experience things called TET spells, which are periods of acute episodes of hypoxia or cyanosis. I remember the one main thing I remember from nursing school is that you always put the infant in knees to chest position to help with oxygenation. So in this case, this is a complication of the expected condition. It's not an expected finding, which is why it's our priority. So options 2, 3, and 4, these are going to denote expected findings. So tires easily during feedings. If you're not quite breathing properly, you're probably not going to want to eat. So tires easily during feedings is something we would expect in a client with tetralogy of Fallot. Option 3, sleeps in 2-hour intervals. Remember, it's a 2-day-old client. This is describing pretty much any newborn. They sleep in about 2 to 3 hour cycles. They feed and then they go back to sleep. So this is an expected finding of even a healthy newborn. And lastly, systolic heart murmur is a characteristic of TET. So in this case, these are expected findings, meaning they're not our priority. Our complication or unexpected finding in option 1 is our priority to follow up. So great job, you guys. Question 2, the nurse is screening pediatric clients for autism spectrum disorder. It would require follow-up if, option 1, a 9-month-old client has not developed a strong pincer grasp. Option 2, a 17-month-old client cannot kick a ball. Option 3, a 24-month-old client lacks spontaneous eye contact. Or 4, a 36-month-old client cannot hop on 1 foot. Drop those answers in the chat. Let us know what you all are thinking. And my favorite question to ask, do we have any new NCLEX passers? Has anyone here recently passed their NCLEX? Is anyone here scheduled to take it in the next couple of days, weeks, or months? Please let us know. We always love to know where everyone is in their testing journey. So drop in the chat when you tested so we can congratulate you or when you plan to test. Already, someone on TikTok takes theirs on Saturday. Diamond on TikTok took theirs today. I bet you did great. Congratulations. So nice to have that over and done with. Michelle is scheduled for the 7th of next month. That's the 7th of July, 7/7. That sounds like a lucky number. All righty. Keep those answers coming. And Jacqueline on YouTube scheduled hers for next month. I see an August 26th, a 10th of July, June 21st, July 29th, lots of testers. We are in a big testing season, so thank you so much for joining us. You are in the right spot to get prepared to take and most importantly, pass that NCLEX. So with that being said, I see a lot of option number 3, which was our correct option. Way to go, you guys. So autism spectrum disorder is a neurobiological and a developmental disorder that's usually apparent by the age of 3, so pretty young. Clinical features will include impaired social skills, impaired interpersonal communication, and lacking spontaneous eye contact is a really big piece of evidence for this. So all of our remaining options are developmentally appropriate. So let's go through them. So option 1, 9-month-old client has not developed a strong pincer grasp. Usually this will develop by the age of 12 months. So if a child's not quite doing this at 9 months, we're not concerned. There's nothing to worry about here yet. Option 2, a 17-month-old client cannot kick a ball. Kicking a ball develops closer to 2 years of age or 24 months. So at 17 months, if this client isn't quite there, again, not a cause for concern. And lastly, option 4, 36-month-old client cannot hop on 1 foot. This is something that we see develop typically around the age of 5. So at 36 months or 3 years, if they haven't developed the ability to do this, again, we're not concerned. But we would be concerned about option 3. This should already have been developed by 2 years of age. This means there is a developmental deficit, which will require follow-up for the potential for autism spectrum disorder. So option number 3 was our correct option. You guys did so well. Way to go. All righty. So question number 3, nurse is planning care for a 3-year-old client who is hospitalized. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Our options are to maintain the client's home routine as much as possible, to demonstrate medical procedures to the client using a doll, ask the parent to bring the client a comfort item from home, use medical terminology when describing procedures to the client, or encourage the parent to remain with the client as much as possible. Alrighty, go ahead and drop those answers in the chats. I see someone saying that the volume is bad. Does that mean too low? We will definitely work on that. Let us know. I'll go ahead and restart this guy and see if we can fix that. Alrighty, keep letting us know if we're still having issues or if it's getting better. Thank you for dropping that in the chat, Mr. Dan. Alrighty, lots of good answers coming in. Way to go, you guys. If you have not already, check out uworldnursing.com. This is our home base for all of our social media efforts. Here you can get a link to our product, a link to our 7-day free trial, access to our question of the week feature, and most notably, our full calendar of times, topics, and channels that we plan to go live. We're now going live 5 different days a week, 7 times a week. So we have lots of different options just depending on what your schedule is. We've now added some evening lives. I know a lot of you are pretty busy with school or with work during the days. So these 7 p.m. lives on Friday and Sunday with Nurse Andrew, we're really hoping meets the need of some of our night owls. All right, I see that volume is better. Good news. Thank you for letting me know. Alrighty, so our correct options here, it looks like the majority of you guys got this right, but it is 1, 2, 3, and 5. So everything except for 4. Our age-appropriate comfort measures for a 3-year-old hospitalized client include mimicking our home routines as much as possible. So for instance, if this client prefers to bathe before they take their evening medications, we're going to try and do that as much as we can. Maybe in the mornings they like to take their meds before they brush their teeth. To the best of our abilities, we are going to try to incorporate these things into the hospital routine just to maintain a sense of normalcy. So option 1, maintain the client's home routine as much as possible. This is exactly what I was just brushing on. We want to make sure that we do that, whether that's a feeding schedule or a nap schedule that we're keeping up. Option 2, demonstrate medical procedures to the client using a doll. Medical play helps to prepare these young clients for procedures or exams. This is also a way that we're going to put it into terms that they can understand. Option 3, ask the parent to bring a comfort item from home. These include blankets, stuffed animals, maybe a doll. We want to keep those comfort items close. They're in an uncomfortable foreign environment in the hospital, so we want to make sure we instill comfort as much as we can. And our last correct option was 5. This was encourage the parent to remain with the child as much as possible. Encouraging the parent to be present as much as possible reduces stress and anxiety for the client. At 3 years old, these young clients are still very attached to their parents and caregivers, so we want to make sure that we maintain this. Lastly, option 4 would be incorrect. So medical terminology when describing procedures to a 3-year-old client is not going to get our point across. They're not really going to understand. Even many adult clients don't understand medical terminology, so we definitely don't want to use it in place for a 3-year-old client. Also really important here is to explain procedures immediately before performing them. So we definitely want to give the parents and caregivers a heads up, explain it beforehand, but these young clients' memories are not super reliable. So we want to explain it beforehand as well as immediately beforehand, because that's the only way they're really going to be able to grasp what's going on. All right, moving on. Question 4, you guys are doing great today. So here the nurse is caring for a 6-month-old client who has bronchiolitis. It will be a priority for the nurse to monitor the client for decreased urine output, nasal flaring, changes in appetite, or option 4 is fever. And a little hint, bronchiolitis is almost always associated with RSV or respiratory syncytial virus, especially in our pediatric clients. Alrighty, I see lots of questions in the chat. Let's see what you all are thinking. Yes, we do have adaptive testing available on our UWorld product. That is the environment that the NCLEX puts you into, so it's definitely important to make sure you practice before you take it for real. All right, I see lots of great answers, you guys. Make sure you are following at UWorld Nursing. We put out so many great resources, most notably so many great free resources. So make sure you take advantage of the 7 lives that we do a week, our question of the day features, our nurse life videos. We've also just started to do concept maps on our live. I know that those always trip me up when I was in nursing school. So here you can always tune in. We have them available on all of our social channels, so you can go back and replay it. Personally, I find our YouTube channel as the easiest one to search. Alrighty, so I'm going to go ahead and jump to our correct option because you all absolutely nailed this on the head. So our correct option was option number 2. So bronchiolitis is that inflammation and increased mucus production in the smallest airways of our respiratory tract. It can cause labored breathing, overall respiratory distress. Bronchiolitis is typically associated with RSV, so the nurse should always be prioritizing those ABCs, airway, breathing, and circulation. So option 2, nasal flaring, is going to be our priority because it's a sign of respiratory distress and labored breathing in a pediatric client. Nasal flaring will indicate an increased work of breathing. It can be a note of impending respiratory failure and a result of worsening bronchiolitis. So our priority here is going to be airway first, because that's the A of the ABCs. Then moving down a list on our priorities, we move to hydration, and then to altered nutrition, and then to altered temperature. So first and foremost, we're worried about airway, which is why nasal flaring is our priority. The rest of the things that we see are going to be expected findings. These clients are at a risk to get dehydrated, so we're going to see decreased urine output. Changes in appetite happen mostly with these clients who are sick. If you think about how you feel when you're sick, you don't have a really big appetite typically. And of course, we can see fever as a result of this. So when we look at priority questions, a great test-taking tip is to differentiate between what is an expected finding and what is a complication, because the complications are things that we need to follow up on first. All right, question number 5. We are smooth sailing today. You guys are doing great. All right, so here the nurse is planning care for a 12-year-old client with sickle cell anemia who is experiencing an acute episode of pain. Which of the following interventions would be appropriate to include in the client's plan of care? Select all that apply. So our options are to maintain an infusion of IV fluids, apply cold compresses to painful areas, provide supplemental oxygen to the client, request a prescription for IV pain meds for the clients, or encourage the client to perform active range of motion exercises? Drop those answers in the chat. Let us know what you all are thinking. And so you guys know, the links that we put in the chat are not clickable. Most of these channels don't let us make them clickable links. So go ahead and highlight it, copy it, put it into your search bar, and that's how you can get there. Simply, if you want to type in uworldnursing.com, that's where you'll be able to find our full calendar of times, topics, and channels that we go live. Alrighty, lots of questions about CAT testing. You guys are doing great today. I also want to make sure we talk about our NSNA partnership. We are partnered with the National Student Nurses Association. We are their official test preparation platform provider. We are so excited about this. We have a really big presence at both their fall and their spring conferences. We just went to the spring one in Seattle back in April. We had a fabulous time. We met a lot of you guys in person, which was so much fun. Let us know if you were there, if you joined us. And we're so excited to go back in November to Columbus, Ohio for the fall conference. So we put on 8 hours of targeted NCLEX review time. We're excited to be doing that again in the fall. So maybe if you weren't able to join in Seattle, you'll be able to come in November in Columbus. And Halo on TikTok says they were there. That's amazing. I hope you had a great time. I had never been to Seattle and I had a fabulous time. It's a wonderful city. So thank you for letting us know that you were there. Alrighty, so I'm going to go ahead and jump to our correct options. It looks like the majority of you guys got 1, 3, and 4. So what are our correct answers? You guys, per usual, are absolutely spot on. So we want to make sure sickle cell, we know, is a hereditary blood disorder. It's characterized by red blood cells that become sickled in shape, hence the name. Rather than the oval red blood cells, they're that sickled like crescent moon shape when they become deoxygenated. So vaso-occlusive crises are an acute exacerbation of sickle cell disease. They can be caused by things like dehydration, hypoxia, illness, infection, and stress. It causes those red blood cells to clump together or to aggregate, and they cause pain by obstructing blood flow. So we want to make sure we do a couple of things to prevent this, to keep that blood free flowing and not clump together, causing a vaso-occlusive crisis. So we want to maintain IV fluid infusion. More fluid helps that blood to flow freer and be less likely to clump together. This would be an indicated intervention. We do want to provide supplemental oxygen for the client. Again, being deoxygenated is what causes these red blood cells to become sickled in shape. So we want to make sure that we apply supplemental oxygen, and we want to request IV pain meds. This can be so painful. We want to give opioids, analgesics, whatever we can do to help to relieve some of this pain. Option 2 and 5 were incorrect. So we never want to apply cold compress because this further vasoconstricts, making it even more likely to aggregate or clump together. We'd want to apply a warm compress to open up, vasodilate, allow this blood to flow freer. And lastly, encourage the client to perform these active range of motion exercises. If they're in a maintenance phase where they're not in an acute exacerbation, this would be totally fine. But we want to decrease the oxygen demand when a client is experiencing a vaso-occlusive crisis. So in this case, at this moment, this would not be indicated. So 1, 3, and 4 were our correct options. Way to go, you guys. It looks like the sound is not working again, so we will take a look at this. Give us 1 second. Alrighty, thank you for letting us know. I appreciate it. It looks like TikTok says we can hear, but maybe it's, is it YouTube that's having an issue? Just keep letting us know. We will work on it. But thank you so much for letting us know, you guys. So with that being said, let's go ahead and move on to question number 6. The nurses taught the parent of an 8-year-old client with attention deficit hyperactivity disorder, that is always such a mouthful for me, or ADHD as we'll just call it going forward, who is a new prescription for methylphenidate. Which of the following statements by the parent would require follow-up? Remember, it requires follow-up, meaning we are looking for an incorrect statement that requires further teaching. So our options are: I will give my child the medication 2 hours before bedtime. My child may experience a decreased appetite when taking the medication. My child's healthcare provider will regularly check my child's height and weight, and I should notify my child's healthcare provider if my child experiences palpitations. Let us know what you're thinking. Alrighty. Our next NSNA virtual webinar will be on July the 14th. It will be myself and the wonderful nurse Nkoli covering OB topics, which we always get requests for, so excited to do that. And then we'll be covering exam strategy, focusing on our select all that apply questions and our priority questions. So maybe if anyone struggled with that priority question about bronchiolitis and the nasal flaring, this would be a great thing to check in on, get a little bit more practice, learn some of these exam strategies. You can sign up on our web or our social media. We'll post a link to how to register for this, and we'll also, NSNA's website and social media will also have information. So at UWorld Nursing or the NSNA social media is a great place to go for this. They are $25 for NSNA members and $35 for non-members. Diana on YouTube, OB is going to be on July 14th. Visit our social media at UWorld Nursing or NSNA social media for a link to register. We would love to see you there. Again, July the 14th. Can't believe we're already halfway through this year. Alrighty, lots of great answers, and it looks like you guys were not fooled by the negatively worded question. Our correct option indeed was option number 1. So why was this? ADHD is a neurodevelopmental disorder characterized by distractibility, inattention, and or hyperactivity, hence the hyperactivity in the name. Methylphenidate, or Ritalin, is a central nervous stimulant. It's used to treat ADHD. It improves focus and attention by increasing levels of certain neurotransmitters in the brain. So adverse effects can include things like irritability, sleep disturbances, and jitteriness, which is why we do not take this medication at bedtime. So that will require follow-up because it's an incorrect statement that requires some further teaching and education. Option 2, 3, and 4 do not require follow-up because they're correct statements. Indeed, it can take your appetite away, so children may experience decreased appetites. This is correct. Option 3, my child's healthcare provider does need to monitor height and weight. We want to make sure the child is still growing and gaining weight despite that decreased appetite. And lastly, we should notify the healthcare provider in the case of heart palpitations. So option 1 was our correct option. Alrighty, question number 7. Someone says the link does not show trial. If you go to uworldnursing.com, there is a link there to get that 7-day free trial. I think it's in the right hand or the left hand side of the screen. It's a yellow button, but yeah. Alrighty, and I'm seeing some requests for cardio lives. That's a great option. We definitely will work that into our content calendar. So our question here is, the nurses taught the parents of a preschool age children about childhood growth and development. Which of the following statements by a parent would indicate a correct understanding of the teaching? Select all that apply. Should they notify the healthcare provider if the child is not toilet trained by 24 months? Can they expect the child to be able to sit quietly for at least 30 minutes at a time? Should the child be able to independently turn pages of the book? Should they be able to communicate in at least 3-word sentences? Or should they encourage the child to assist in household tasks? Select all that apply. Let us know what you think. If you can't find the trial, honestly, you can just Google 7-day free trial UWorld and it will pop up. I promise you we have one. But that's a great way to get accounted for and really acclimated to the NCLEX UWorld product, just how many ways you can filter and tailor questions to practice tests that focus on exactly what you want more practice on. So make sure you check that out. Alrighty, and keep letting us know the topics that you want to see. I see a lot of requests today for cardio topics. I see someone requested to do a live on aneurysms. These are great recommendations. We will definitely work this into our calendar. Also, speaking of new concepts, we are going to be doing another concept map. This is our 3rd concept map live. It'll be next Wednesday, so a week from today, and we're going to do traumatic brain injury. So hitting those neuro concepts, which can be pretty tricky. So I'm excited about that. I promise I will try and make my handwriting as legible as possible this time. But the good news is we do show you all a typed version afterwards. So if you can't read what I write, at least you can read the typed version. All right, so great answers coming through. Way to go, you guys. Our correct options here were 3, 4, and 5, and it looks like the majority of you guys got this. So developmental milestones are kind of tricky, especially for those of us who have not yet had children. I think they feel kind of foreign sometimes, but they're essentially just expected patterns of growth and development depending on the child's age group. So our expected milestones of a preschool age child are going to be things like turning pages of the book, option 3, communicating using more than 3-word sentences. This is true, and being able to assist in household tasks and follow 2-step directions, meaning you can give 2 parts. Maybe it's go inside and get your backpack, or go in and grab your shoes and put on your socks. So those are what these 2-step commands would be. So 3, 4, and 5 are our correct options. I don't know how much time you all have spent with preschool age children, but option 2, sitting quietly for at least 30 minutes, is going to be kind of a pipe dream that's not really going to be realistic. So that would also be an incorrect option. Way to go, you guys. All right, I see someone asked 3,000 words. We are not expecting them to know 3,000 words at this age. But no worries. I see more topics on psychosocial care. That is a great review. Oh, wow. And Lori on YouTube says, can we do a neuro review, including ICP and TBI? You would really do well to join our Wednesday Concept Map Live next week, because we're doing TBI, which is kind of an umbrella term, and it covers a lot of things, including like DAI or cerebral edema, contusions, hematomas, epidural hematomas, subdural hematomas. So we're doing a lot of neuro concepts combined under the umbrella of TBI. So definitely join us next Wednesday at 11 a.m. Miss Lori Blaine. All right, so the nurses taught an adolescent client with newly diagnosed type 1 diabetes mellitus, which of the following statements by the client would require follow-up. So this condition can be managed by following a prescribed diet. 2, I understand this condition is an autoimmune disorder. 3, this condition requires me to monitor my carb intake. Or 4, I understand I will have this for the rest of my life. All righty. Someone asked me to pause for longer so you can think it through. That is a very fair piece of feedback. I will. Alrighty, people are asking for mental health topics. We will definitely work that in. You are so welcome, Lori. Thank you for joining today. Alrighty. Have we all had time to drop our answers in the chat? We just have a best answer, not a select all that apply. So I'll give you a few more seconds. Go ahead and think it through. And I'm going to jump to our correct option. I hope I've given you enough time, but let me know if I haven't. Our correct option here is option number 1. So in this case, it looks like we're kind of split across the board. We're talking about type 1 diabetes here, and I think we may have gotten it wrong because we were confused between type 1 and type 2. So clients with type 1 diabetes, this is an absolute deficiency of endogenously produced insulin, meaning they're going to require exogenous insulin therapy for the rest of their life. There is currently no cure for diabetes, so this is something they're going to have to do for the rest of their life in order to control their blood glucose. Now, clients with type 2 diabetes can improve through diet and exercise. Some type 2 diabetes clients can be controlled on medications like a metformin and actually don't need to have to take insulin every day, but on type 1, they are completely lacking endogenous insulin production. Therefore, they will always need insulin. So saying that the type 1 diabetes clients can control this through prescribed diet is untrue. This requires follow-up because it's false. They will also need to be on some sort of insulin regimen. 2, 3, and 4 do not require follow-up because they're true. So this condition is autoimmune. It's the autoimmune destruction of the pancreatic beta cells. This would be correct. Therefore, it does not require follow-up. 3, this condition requires me to monitor my carb intake. Totally true. This is how we help to dose our insulin, by maintaining consistent carbohydrate intake. We want to avoid those really high peaks and really low valleys, so keeping it tight and controlled in the middle. And lastly, I understand I will have this for the rest of my life. This is true. Currently, there is no cure for diabetes, so they will have this through the rest of their life. I see people a little bit confused about that. Someone asking, it's diet, not insulin. The other way around, type 1 diabetes, you of course need to manage your diet, but you have to be on some form of insulin regimen. They cannot only control type 1 diabetes solely through diet. They need insulin. So way to go, you guys. You did so well today. Make sure you tune in tonight at 7 p.m. Central Time with Nurse Andrew, and we'll be back tomorrow with Nurse Coley at 11 a.m. and 3 p.m. Have a great rest of your day.